is Senator John Bell, who happens to be my delegate to the General Assembly. Before we hear from Senator Bell, you will hear from David DiBiase, AARP Virginia's Advocacy Director. If at any time during the forum you'd like to ask Senator Bell or David a question, please type your question into the question and answer box at the bottom of your screen. We will take as many questions as our time together allows. Now I'll turn it over to David.
Thank you, Laval. Good to be here for this conversation about this year's General Assembly session in Richmond, which featured debate on a wide variety of important issues. It was another year where AARP Virginia volunteers and staff teamed up to fight for priorities that are important to people ages 50 plus and their families. We worked on primarily 3 different pieces of legislation, one to help rein in the skyrocketing costs of prescription drugs, another to increase nursing home safety and quality for the state's most vulnerable residents, and a third to provide family caregivers, who are the unsung heroes of our long-term care system, with a tax credit to cover the cost of necessary out-of-pocket expenses. And we're lucky, that is AARP Virginians, that is aging Virginians are lucky to have a committed legislative champion like Senator John Bell leading the way for us in Richmond. We've worked with him over the years on various issues, but this year we especially appreciate his leadership on lowering the cost of prescription drugs. So let me introduce our guest. Senator Bell is a small business owner who, since 2016, has served as a member of the General Assembly. He is a retired Air Force Major Finance Officer with 25 years of experience. He has a master's degree in organizational development from George Washington University and an MBA from Western New England University. Senator Bell lives in South Riding with his wife, Margaret, and 2 dogs. Senator Bell, thank you for joining us this afternoon. We appreciate your leadership on reining in the price of prescription drugs. Please tell us about your work on the Prescription Drug Affordability Board legislation, as well as other issues that you're working on for older Virginians.
Absolutely. First, thank you for hosting this town hall, and thank you for the very kind invitation and everything you do to help people across Virginia. Greatly appreciated. It's great to be with you today. First thing I want to talk about before I get into the bill on prescription drug oversight is we announced yesterday the special session is going to reconvene on June 1st. And that's important. We did not come to a budget agreement during the regular session, so the governor called a special session. We came back together. There still wasn't an agreement. So we've had people continue to work on negotiating on the budget, and we're coming back on June 1st. My belief is that we'll have that published to the public several days before we come back. And I'll make sure I have that announced on my Facebook, website, et cetera. So hopefully people can get online and take a look at that budget and see what we are going to go and decide on June 1st. Important we do it on June 1st. Our fiscal year ends on the end of June, and the new one starts on July 1st. So there's many important services that we need to make sure that budget's intact. We have debt obligations we need to fulfill. And obviously, all across Virginia, our local communities depend on the budget they get from us. Right now, many of them have had to pass budgets in the dark, not knowing what they're going to get from the General Assembly. So we will have to get together and do that. I will tell you, good news, Virginia has a pretty large surplus right now. We began the General Assembly session January, estimating about a $13 billion surplus. So I think there's going to be many good things in this budget to help people out. One of the issues that we have studied quite a bit is our Virginia economy. We're in great shape. CNBC named us the best state to do business 2 years in a row, which is unprecedented. So our economy has actually done really well. We had some pretty rough estimates when COVID first really erupted, and we looked at it and tried to take a conservative view. Fortunately, our economy has turned out better than we thought it would. And now we're in a very good position. One of the things we're going to have to, I think, look forward to working to help people out is inflation. It's rising very fast, and it's a challenge. And frankly, I don't think we're near the end of the rise yet. On that line, one of the bills I was very happy to be a co-patron of and to work was the Prescription Oversight Board bill, which is SB 376. And we're going to actually put this, if I'll ask Aaron, he's my assistant, if he could put that a link to that on LIS in the chat so anybody can see that and make sure that people have access to that. I think it's a very good bill. Unfortunately, it did not pass this year, but we're going to come back and work on it again and try to get something along that line passed. I know, frankly, anytime we take on big pharma, it's not going to be easy. There's going to be a lot of headwinds. We're going to have a lot of opposition and well-funded opposition, but we know we need to make this fight happen. Affordability is a problem across the country. We have 6 states who've done prescription oversight boards already, and I believe that they've shown a great progress and really usefulness in controlling the cost of drugs without hampering the cost of any research and development. So I think it's very important that we have this kind of oversight. And some of the issues that we've dealt with and we've seen is drugs that have been out for a very long time, that the chemicals are cheap. And frankly, there's been no new mechanism of administering or treating with those drugs. Examples are insulin or the EpiPens, but yet we've had huge price increases. Another concern, I think, for many senior citizens who suffer with rheumatoid arthritis is the extreme cost of some of the very promising treatments, frankly, that we see advertised on TV almost every day and every night. The rheumatoid arthritis has the non-biologics, most of which have been around a long time, and the biologics, which are relatively new. And there's many common names that you probably will see on TV all the time, but it costs between $20,000 and $50,000 a year. Very expensive. My sister suffers from rheumatoid arthritis. She's a couple years older than me, and she just had to change drugs in the first month of her new prescription. The cost is $25,000. Now, fortunately, she has insurance, but her copay is still $5,000 to $6,000. I think that's ridiculous. And we need to look at, while we can still make sure that we incentivize research and development, that we also do not allow price gouging. We also don't allow things to happen that are going to be against the greater good and prevent people from getting life-saving or life-altering drugs and treatments. So this is something we'll come back on. We get some good feedback from a few people. We will meet with all stakeholders and work on this, because I think we need this oversight board here in Virginia, and we need to make sure that people have the ability to get access to prescriptions and medications without losing their financial livelihood. I don't think, from a value perspective, someone should ever make a decision between, or choice between, do I get food, do I heat my home at a proper level in the winter, or do I buy the prescription medicines that I need? Yet we know many are currently having to make that choice. So this is an issue that we need to continue to work on, and it's a very urgent issue. So please know this is one that I will continue to work on. As far as you mentioned oversight in senior living facilities, nursing homes, et cetera. I agree, those are our most vulnerable citizens. I actually experienced a personal issue with this. My father-in-law had some medical issues and was in assisted living, and he did not have COVID, but during the scare of COVID, they wanted to prevent him from coming back to his home, even though he didn't have COVID. And but they still wanted to charge him to be there. And unfortunately, we've seen a number of instances exactly like that, where I think people who may not have representation can be taken advantage of. And this is something that we need to continue to monitor. We've done a lot as far as inspections and oversight during COVID for safety, because we knew that nursing homes and facilities were very, very high risk. So this is something that I think will continue to be a cause of concern as we go forward. Having said that, I think in the program now, I will turn it back to you after my opening remarks here, and be happy to answer questions or go into specifics as people desire. So I'll ask, who is going to sort of, is somebody going to bring up the questions, or how are we going to work that?
Hi, Senator Bell. I think that we may have lost David here, but I am happy to jump into some questions.
Sure.
We have a question. Someone would like to understand more about the oversight board and how individuals who serves on them and how are they selected?
Absolutely. Well, the bill, as I said, we'll put that in the chat if we can, the link to that. I'll see if I can do that right now.
I believe Aaron has done that.
Okay, great. Yep, I see it already there. Okay, the bill basically would form a oversight board, and the board, there's mechanisms in it where that we would have, if we had significant price increases and or we were able to be notified of price increases by stakeholders, we could then look into the affordability issue and take that on. Doesn't mean we would review every drug, but we would try to look for those egregious ones. And the ones I mentioned before, EpiPens, insulin, drugs that have been out for a very long period of time. And frankly, many of the drugs in the market, the names get changed as they're acquired from one company versus another. But oftentimes the ingredients or the mechanism of delivery doesn't change, yet the price goes up as one company is acquired by another. Valiant Pharmaceuticals received a lot of attention for this. They would acquire other companies, not really develop their own new drugs, and then have dramatic increases in price, which again really hurt the livelihood and health of people. So basically, this tries to look at that. In the bill, we gave a kind of a straw man approach of how the people would be selected, and what we were trying to do is take stakeholders from a variety of groups. We didn't get to what we thought was the final setup of who would be on the board because we wanted to leave that open. But for negotiations as part of developing the legislation. Our belief, though, is that we would have stakeholders from basically a variety of different groups on it. So we would need people who are medical professionals, and then we would also need people from the community. If you look at the bill and you pull it up, it goes into the board makeup starting on lines 39, and they're numbered, and the appointments are specifically spelled out on line 44. And most of the appointments are the boards around Virginia kind of work like this. The governor gets so many appointments, and then the General Assembly gets so many appointments. Half of them usually going to the House of Delegates, half of them going to the Senate. So by having that separation, there's a much better chance of having a good board that can really serve for the best of the community. The term of the boards is for 5 years. Again, there's negotiation in there, but this is, we believe, based on best practices and what's worked well with other boards. I'm on several boards right now, and we've kind of used the same format. I serve as the chair of the board for Board of Visitors for the Virginia School of the Deaf and Blind. I'm on the chair of the Substance Abuse Commission, and I'm on the Small Business Council. So these are all kind of along those same lines of those charters. But again, we're open to negotiating if we can come up with something that works better. The key point I want to make on this is if you look at line 49, we've spelled out conflicts of interest, both personal and financial. I think that's very important because we've had problems with boards. I was very involved in reforming charitable gaming this past year, and we had problems with people on the charitable gaming board who had direct conflicts of interest and financial gain, and yet they did not reveal any of those issues. So that's a problem. We often have people serving on our agricultural boards, wineries, et cetera, where we need people with knowledge in the area who are still current business owners, and that's okay. They have conflicts, but the key is acknowledging what those conflicts are, recusing themselves if they have a vote that would be a personal financial gain, and we want to make sure we have that kind of protection here. So there's a number of things that this board seeks to do, but the bottom line is we want to make sure that we have the ability to get involved and to legislatively through this board as part of that overreaching arm to make sure that people don't get in there and gouge people unfairly with the prices of these drugs. I'm not hearing
David,
you.
you're on mute.
Yep.
I was saying, you lost me there for a little while. My Zoom froze up. So thank you for continuing on. And thank you for sharing the update on the budget coming June 1st and talking about the Affordability Board, or as you're calling it, the Oversight Board. As a reminder to you all, if you'd like to ask Senator Bell or myself a question, just type your question into the Q&A box at the bottom of your screen, and we'll take as many questions as our time together allows. While questions are coming in, we did want to hear from you in the form of a poll. So you should see a question come up on your screen. It's going to ask, in the past 2 years, have you ever not filled a prescription medication that your doctor had given you due to cost? I know the words due to cost are not in there, but due to cost in the past 2 years, have you ever not filled prescription medication that your doctor had given you? And obviously your choices are yes, no. You can click the bubble that indicates your answer. And then the second question is, thinking about the next few years, how concerned are you about being able to afford the cost of prescription medications that you or your family member may need? And then your options: very concerned, somewhat concerned, not too concerned, not concerned at all, and don't know. So register your votes now, and we'll see the results of the poll in just a moment.
Yeah, I think that's a great poll question, and frankly, the more data we can get on this, the better. And if I can use this kind of question as a moment to encourage people to come to Richmond, and I know it's hard. We still have the Zoom or remote ability to testify, but we have bills like the Oversight Board. We really need to have citizens from across the Commonwealth testify, and frankly, the citizen testimony is powerful. If people can tell the story of, say, I didn't get my prescription filled because it was too much, then I think we need to know that, because that is a really important thing to get out there. So I would encourage people to do that. If you ever need to know how to do that, again, you can contact my office, and we'll be happy to guide you on that. I know the good folks at AARP will be happy to help you with that as well. And if you're down in Richmond, let me know, and I will come and visit you. If you want, I see some of the questions on here. You want me to just start going down the list?
No, I'll do that.
Okay.
Yeah.
Okay,
So the results flashed on my screen and then it went away, but it looked like the majority of people on the call did not have that experience of not filling a prescription. AARP did a study that showed that in Virginia residents, 1 out of 4 had not taken a prescribed medicine as prescribed by the doctor due to cost. So in other words, if the medicine was supposed to be taken, let's say twice a day, people had chosen to take it once a day to make it last longer. Or maybe if it's supposed to be taken every day, they took it every other day. And of course, if you're not getting the therapeutic value of the medication, you're really not taking the medication. So you certainly don't want people not taking prescribed medicines as directed due to cost. And then the second question, I guess that flashed a little quick as well, but it was about concern for medications in the coming years. We know that we pay more than 3 times the cost of drugs as compared to other countries. So we really are on the high end. And as Senator Bell had indicated, it's not about getting them money for research and development, because over the last 10 years, they've spent far more on stock dividends and stock buybacks than they have on research and development. Most R&D is funded by the government. And lastly, they spent over $6.8 billion, this is pharma, on advertising alone in 1 year. So the issues of cost is just lining their pockets. Ginger, you've been monitoring the Q&A. What do we have for our first question?
Well, we have another question about prescription drugs. So if we want to continue to talk about that before we move on to another issue. We have a question from someone who works for a nonprofit organization that represents small business owners. And they want to know if small business owners can be helpful in moving the needle and passing Senate Bill 376. And if so, how?
Yeah, thank you for that question. I think absolutely. As a small business owner myself, I think it's important that that we have. Oftentimes, I think as a legislator, one of the things I try to keep in mind, I know a number of others do this as well, is sort of the legislator's Hippocratic oath: first, do no harm. And small businesses represent 50% of our economy, so we certainly don't want to do things to hurt small businesses. And healthcare plans for small businesses are often, one of their major costs. So we make sure we do things. But I think having small business support would be huge. And frankly, I think it will help if we control prescription drug prices. We're going to help small businesses out because that's one of the key drivers to making plans so expensive. The other part is making sure that we can do everything we can to lower the co-pays people have for prescriptions. And again, having small business voice there, I think is critical. As part of my introduction, it was mentioned I'm a small business owner, and we provide healthcare to our employees. And we go out and we look each year to see what we can do to try to give a better plan to our employees and to lower the cost. And we look at those co-pays, both for doctor office visits, for prescriptions, and do things we can try to lower the cost. So I think having small businesses be part of this discussion. And again, I think the message, which I believe is very true, is that having this oversight and this additional tool in the tool belt to control price gouging, which is really what we're talking about, is going to help small businesses. It's not going to hurt, and it's going to help the business climate in general. And as David mentioned, it's not going to stop research and development. That's still happening. But what it's going to do is going to force, I think, some ethical behavior, because the other side of the coin is we look at big pharma, and I'm not here just to bash big pharma because I know there's a lot of good that comes from big pharma, but let's be honest, these companies have received billions of dollars of tax benefits and credits from our country, particularly over the last couple of years. And I think they owe it to our citizens who've given them these tax breaks not to be gouging us on life-saving and life-altering drugs, particularly on these older drugs. Those are the most egregious cases. And frankly, something like insulin, which someone absolutely needs, and many of the biologic drugs I talked about with rheumatoid arthritis and other conditions, once you start taking them, you can't stop. This is a long-term commitment. So, the point that I think David made was sometimes people will take half of the prescription to stretch it out. Many of these drugs don't work right and can have other, problems if you were to not take it as prescribed. So a long answer to a short question, but absolutely small business, I think, is a critical voice, and would love to have some more small business on all of these issues. Home care, many home care providers are small businesses, and they struggle with many issues related to providing home care. So the small business has a huge voice, or, I would love to have a huge voice from small business on these issues.
Ginger, I didn't introduce you properly. Our Director of Advocacy, Ginger Thompson, monitoring the Q&A. Ginger, what else do we have for questions?
Well, there's another question related to the pharmaceutical bill, is how to convince legislators who might be on the fence or against the bill that they need to support it. Is there something that we can do as constituents to help move this along?
I'll take a crack at that first, because legislators should be voting for this. Legislators from both parties should be voting for this, because it is going to save the government money. It's not actually going to impact the consumer as much as the government, because most of these are covered by Medicaid, most of these drugs that have the high cost. And if you can lower the cost of what Medicaid is paying, you're saving the taxpayer money. So taxpayers will save, our government budget will save, consumers are less likely to be the ones who get the direct impact from this bill. But the reason that legislators should vote for it is because everyone wants to reduce the cost on the government and the taxpayer.
Yeah, I think it's a great answer. Bipartisan legislation, it is always better. And unfortunately, we didn't have any Republicans sign on to this bill. I'm confident we'll win some over. I've had those discussions, and we've tackled a number of really tough issues related to, healthcare. For a long time, we didn't do Medicaid expansion in Virginia, and then that became a bipartisan issue. There were still some strongly opposed, but it was, frankly, I think, good for Virginia, helped out many people. We've done a lot with the drug addiction, and I've worked with many Republicans on that, and we've had to really look at hard data to make tough decisions on what is best to save lives. So in the long term, I'm confident that we will get people to come on board and support this. I will say that in my 7 sessions in the General Assembly, the one thing I've learned is sometimes really big, important things don't happen in one session. We would love them to, but they don't. They often have to be seasoned. People have to get used to the idea, and we have to get many stakeholders involved. But the more you can communicate with legislators, visit them in person. If you come to Richmond, I know COVID made this hard. You can generally get to see multiple legislators same day without an appointment. I usually ask groups who stop by and see me when I'm down there without an appointment. They just stop by and I meet with them. How many people they've seen? They usually see 6 or 8 legislators that day. And trust me, what you say does matter. So I would make your voice known that this is important, and it will help us win the hearts and minds of people to get this to be a bipartisan supported bill.
The stories are particularly important. Like, I can read you some statistics, which I will for just a moment. But if you're the person taking this drug, your voice means so much more than me reading statistics. So there are 681,000, a little more than 681,100,000. So close to 1 million, right? Virginian residents with cancer. And Revlimid, which treats a form of cancer, in a 5-year period jumped from $185,000 a year to $267,000 a year. There's almost 600,000 Virginia residents with diabetes, and Victoza, which treats diabetes, in a 5-year period jumped from $8,000 or just below $8,000 to over $11,000 per year. And then there are close to 600,000 Virginians who have asthma or COPD. And Spiriva, the HandiHaler, which treats those conditions, went from $3,800 a year to $5,200 a year. So these egregious price jumps are where this bill would have helped. And if there are over 600,000 people with cancer and close to 100,000 with diabetes, we need those faces, those stories to show up. And I will provide our phone number and our email at the end of this call, because if you or a family member has a story, that's the story to tell. It's not a paid lobbyist like me, because I'm not as believable as the real person. So we need real people stories.
Yeah, I could agree with that more. And I will tell you, as a legislator, people think we have, certain political things we're trying to achieve. I'm a very pragmatic person, and I try to do what I think is right, what I think is best. And but a citizen, someone coming in and telling that heartfelt, true story does move hearts and minds. It does get people to really understand. I had a bill this past year, and frankly, whenever someone comes and says, this is going to be an easy bill, would you please carry it? I'm going to now put up my blinders and really look at it harder, because it turned out to be probably the hardest one I've ever done. And it was about getting subcontractors paid for work that they've done, because we had some bad actors who would come in, have people do work for them, and they wouldn't pay them. And it was mainly non-Virginia companies coming in to operate here, even though they had laws in their home states making them pay people there. And it was a hard-fought battle, but we had, I think, 17,000 contractors who signed no petitions. Many came to Richmond, and they talked about how that they were not getting paid for work that they've done. And story after story, it really allowed that bill to get passed. So that personal interaction is absolutely huge, and it's something we really need.
Thank you. Ginger, other questions?
Yes, we have a question about nursing homes. What is the General Assembly and AARP Virginia doing to protect the health and safety of nursing home residents?
You want to give that a shot?
Go ahead and go first.
So AARP is focused on the staffing issue. We know that if you have high staffing, you're going to have fewer infections, fewer urinary tract infections, fewer falls, fewer bed sores, less use of prescription drugs for psychotic reasons, prescription antipsychotic meds. Let me look at my notes here. Fewer hospitalizations in nursing homes. So high staffing correlates with better outcomes. Yet 78% of our facilities in Virginia, or 207 of them, don't meet a staffing standard that CMS recommended from a study back in 2000. And that was 4.1 nursing hours per resident per day. And that nursing is used very liberally. So it could be a certified nursing assistant, an LPN, or an RN. And combined, their hours had to add up to 4.1 hours of that nursing care per resident per day. So 78% of our nursing homes don't meet that standard. It's not a mandate, it was a recommendation. So they don't have to meet it. But Virginia was trying to pass a law. AARP went to Delegate Carr and had her put this forward this year, and it failed. There was another bill that went at 3.1 hours of nursing time per resident per day. That also failed, and that would have 44% of our facilities wouldn't have met that standard. So if that bill had passed, we would have raised the standard in 44% of our facilities. The AARP bill would have raised the standard in 78% of our facilities. That's what AARP did to try to bring the quality of nursing homes around. But there were other measures, mostly in budget amendments, that were coming from different angles.
Yeah, I mean, I think one of the key things we have to do is continue to provide oversight and make sure that we have people from our government. Usually it's Department of Health and Human Services. We need to get them out in these VDH, in these nursing home facilities on a very regular basis. And we have certain compliance issues. We need to make sure that we're pretty unforgiving when people are not in compliance. And we, because frankly, we are the advocate. We are the one that should be holding them accountable. And I think having people out, in the facilities often, not just on scheduled, but unscheduled visits is critically important. So one of the things that I know we've looked at is making sure there's enough people to go out in facilities and that they're adequately funded and staffed to do that. And that we provide that data back to the General Assembly, to the governor, so we can take action when we have bad actors. We've obviously been very involved with COVID. I mentioned that earlier because we had some extreme problems when COVID infections were in facilities. And we worked pretty hard to try to take a number of different precautions to prevent the spread of COVID. Unfortunately, in many cases, I think we trying to do something good, we made people prisoners in the facilities and dramatically hurt their quality of life. So it's a tough balance. It really is, because when you're fighting something, particularly in the early days of COVID, when we didn't know much about it, I think some of the good intentions unfortunately hurt people. So I think we always have to balance that going forward.
Thank you. Ginger, I think we have time probably for one more question. Maybe
Okay. All right. We have a couple of questions about Medicaid, and I'm going to try to put them into one question. Virginia expanded its Medicaid program in 2018, and we have one member of the audience, who points out that helped a lot of people in between the ages of 55 and 64, and they're concerned about whether or not that will be rolled back to the pre-Affordable Care Act levels, or what else can the General Assembly do to make health care more accessible to Virginians? Is that expanding Medicaid or taking some other measures?
Well, I think first, let's talk about Medicaid expansion. The Senate is controlled by Democrats. So while the Senate is controlled by Democrats, regardless of the House flipping and the governor being a Republican, we're not going to allow Medicaid expansion to go back. We're just not. I mean, there's been a number of things we've referred to as the brick wall. This is definitely a key part of it. The good news is, I think it's important to remember this, there's a number of people, Republicans, who supported Medicaid expansion. And the House was under, the House and the Senate were under Republican control when Medicaid expansion happened. We had a Democratic governor. So there were people from the Republican Party who supported Medicaid expansion, still do. If you look at the good it's done, and frankly, the financial benefits to Virginia, it would be very difficult to undo that. We have about 25 hospitals in Southwestern Virginia. Some of these are smaller facilities. they were on the brink of bankruptcy prior to Medicaid expansion. They're all doing well now. So it would really endanger a number of facilities and care options across Virginia if we were to undo that. So right now, I can tell you I've heard of no efforts that have any kind of support that would be supported. What we can do to expand is, I think first we need to continue educating people, because while we have enrolled a great number of people, there still are many without health care, and there's no reason for that. We need to make sure we have processes that are easy to use. We're constantly working on that. And we also, I think, need to have the touch points when people have a care situation, that if they don't have insurance, we get them insured. And those are things that we can improve on. Again, COVID has made that difficult because some of our in-person touch points didn't happen. But this is something I think we need to continue to look at. If we look at, we have very high employment right now, but if someone's consistently losing a job, we found research shows it's often a healthcare issue related to why they are not working. We need to use that as a touch point again to get them into a healthcare program. Every research shows if you have a normal healthcare provider, your care, your prognosis, your treatment is way better. So those things are critically important.
Thank you. Well said. We need more education and make sure people can sign up when they need to sign up. So we are nearing the end of our time. Senator Bell, would you like to end with any closing remarks?
Sure. I'm going to step over the Q&A real quick. I see two quick questions. I can get them real quick. One, sure. I have never received a donation from a big pharma company. Don't plan on taking one. Doubt that they'll seek me out given that I supported that bill, but I'll answer that one real quick. The other one is reduced taxes for retirees. We will announce this budget. There's going to be some tax incentives. There's going to be some tax returns, rebates that will go to everyone, and in particular retirees. I can't tell you the final numbers now, but there is going to be tax relief there. When you have a $13 billion surplus, you need to look at giving some of that money back. And one of the things we're doing for retirees, I'm a retired military member, so I can't say there's not a personal issue here, but we're looking to reduce or eliminate tax for military retirees. We're one of the few states that gives no relief for military retirees. I can't tell you it'll be 100%, but I do believe we'll get a significant step forward, and we'll also probably phase in more of those relief, those incentives going forward. So I think that's another one that we're going to take advantage of going forward. The last thing I'll say is thank you again for letting me be a part of this, and I really appreciate this, and thank you for the great work you do. I look forward to continuing to partner with you, particularly on this the oversight, the whatever the next version of SB 376. We'll look at the 6 states who've done it already, find out what we can learn from them, and we'll continue to work to win hearts and minds to get more support for this really good initiative, which I think benefits everyone. So don't be discouraged. Sometimes it takes a few years, but we are very committed to getting this done, and we'll keep working on it.
Well, thank you very much, both for your diligent work in Richmond on behalf of older Virginians, and for today, spending time with us and sharing such good information. I want to thank everyone who participated as well. Thanks for your questions. And let me close by saying, if you want to know more about AARP Virginia's work in the General Assembly, that you can get in touch with us. I know it's been put in the chat as well as on Facebook. And if you did register for this program, it'll also be in a follow-up email that you'll receive with our contact information. So please be in touch. We'd love to hear from you. If you or your friends have a story about how these issues are affecting you, we want you to share your stories with us so that we can help you share them in front of legislators who are making these sometimes life or death decisions in our General Assembly. Again, our email and phone number will be in a follow-up email. I hope to hear from you. Thanks for participating in our 2022 Legislative Forum, and I hope you can be a part of our 2023 efforts. Have a wonderful remainder of the afternoon. Thank you and goodbye.